Okay, please excuse the mess, but I'm just gonna go over, I'm packing for Emrg here in my living room. I'm gonna go over a few items that are, might be new to you. First of all is these little eye wash kits, and in each of these, we have a little cup. This one's open just because I wanted to show you guys. There's a little cup that screws on to this little water bottle. And then you'll have the person put it over their eye, and you could either squeeze the bottle a little bit or, just kind of hold it over their eye and let them rinse it out. I also do have some cups that do not have holes in them. Even the salt spilled over there. So in the eye wash station, so we will have these little bins in this eye wash station. I have all the general stuff. I have a little bit of sterile water, and you could put it in a cup and then just kind of put the cup over their eye and they just blink. There's also one of these that I'm gonna put into the, I'm not sure yet, actually. So there's that. Each of these little containers will be put onto a shelf. So I have some Coban, Ace bandages, eye wash. I'm also gonna have an extra, so we do have a KT tape bin over here. I am gonna have a little extra station like in the black boxes. So I'll show you these now. There's like a privacy cloth if we need it. But in here, there's extra rubbing alcohol. There's weird little kits if you need them. We shouldn't be doing anything like that, but just in case, who knows? I'd rather have it and not need it. There's extra peroxide, extra little packing gauzes, wound wash. So we have quite a few little wound washes in here. And if some of these waters are expired, so they can be used, for whatever non-sterile. These are for like if you put on a bandage and they're gonna go play in a game, you can cut it to be like an arm sleeve to go over their bandage so that it doesn't get dirty. And here's some peroxide wipes. So these are, I'm gonna just leave these in the extra supplies probably. This tape, I wasn't quite sure what it is. This is an extra roll. I do have a roll of the Hypafix in the dressings. This is like a, you can tape a 4x4 or like, I guess a 4x4 or a non-adherent dressing onto the skin, and this is actually pretty flexible and breathable. So like knee, road rash, this is going to be really great at Summerfest on the turf. So there's that. And so this is an extra supply bin. We're also going to have, some more non-sterile Q-tips because, we use a ton of that. These are tiny tampons for nosebleeds. I did recently learn when I was doing like some backwoods medicine classes, I always assumed that we could also use these like in the event that there was a gunshot wound. I always thought it would be fine to use these, and I recently learned that they're actually terrible, that it's better just to put like to stuff it with stuff. So you could stuff it with like an ace band. I mean, in Jesus' name, we're not gonna have any gunshot wounds, but if there is, it's better to stuff anything, like stuff this in here, well, they said with gauze to be careful because you want one long piece Or so like you could do an ace bandage, you could do your shirt, things like that. Now every year we have had a fingertip cut. So these are to make like little tourniquets on the finger to help stop the bleeding. These will be on top of the shelves along with this little bleeding kit. This has some of the bleed stop powder in it because those fingers, we've had a kind of tough time getting them to stop bleeding. So all of this stuff will be out, but I like to I figured this year I would try to kind of show you guys my way of thinking of things. So if you notice some things are different, these will be the little kits that I'm going to put in each backpack. Each little backpack, I'll make a separate thing to go through that, but I have like a little silver gel that I've got, and I'm going to put in here instead of this triple antibiotic ointment, just because with all the antibiotic resistance, the silver is really great. Like, let's get back to basics. So, oh, this is great that I came across this. So these little Band-Aids that you'll see in your kit, they look different. They're like this. Let me open this and show you. So when you open these, they look normal, but on the other side, like they say Sure Seal XL, and you can see they're actually a pressure bandage. So it's really cool. I had a face laceration that I thought I was gonna have to send a girl for stitches after the junior high lock-in. And instead I was able to put some of this with the gel. And can you see how thick that is? It actually absorbs the fluid and puts pressure on the wound. And it like slid her wound together so nicely that we did not need to, she didn't need stitches. It was beautiful. I took it off the next day for her at church, and it was just so beautiful. But like here on the dressing, you see with fluid, it really does increase to that big. So it really helps to put pressure. So try not to use those in a regular situation. This is salt that spilled. Here's our wound cream. This is a silver gel, and you can see it looks just like that. What I do is I squeeze it right onto the Band-Aid and then squish the Band-Aid on. But you'll see this is new skin. So then we just use these sterile Q-tips, put that in the new skin, and then drip that onto whatever needs stitches. We have some little anti-itch cream. I've been trying to go through and get rid of stuff, but here's a wound wash. The other ones might say like saline rinse or whatever, but it's kind of what we use. More Q-tips for like if you want to reach into this silver gel and put it on, you can. Here's some peroxide. Okay, so these are actually really cool. The lidocaine, oh yeah, see, here you go. See, this says nasal mist, but we use it for wound wash. So there is a lot of these like little lidocaines to put on things. The lidocaines actually are vasoconstrictors, so they help to stop things from bleeding, and they help with the pain. Here's a new skin spray, which I really haven't used that much, but there's a bleeding control spray. Now, this is the one that always gets the most conversation, and I'm gonna explain here. Okay, hemorrhoid relief cream. So this has, oh man, this one's just lidocaine. Some of the hemorrhoid creams, have, oh, maybe it's this one. Yeah, okay. So it's really great for splinters and bee stings because it has phenylephrine, which actually is a vasoconstrictor. So it stops the swelling and the bleeding to the area. The glycerin, and the petroleum, don't love it. But the pramoxine, whatever, is also for pain relief. So you could, all of these, like a lot of these gels are just lidocaine. So I did do an oral gel. This also is just alcohol. So I don't know, you guys, but some of this stuff has been in here for a long time. This is another one of my favorites, the Correct-X. If it's a scar somewhere where like you could see it, I love this stuff. This has the frankincense and the helichrysum. So good for scars, like on the face for that little girl that I did at the junior high lock-in. Looks beautiful. These powders are for like if guys come in and they've had like a really hard time with chafing and stuff, you could put some of this on like 2 gauzes and give it to them to go take in the bathroom. Although nobody's ever asked for that yet. All right, let's come over here. So I will have hydration packets. I do have a finger stick machine. They are, there'll be one in the trauma bag and then back at the first aid station. So, you know, and then the little, we have some gels, but we also have these. These do not expire. They're amazing. They're like powder, so you do need to put them in, but then water is good with it. But they actually are so amazing because they taste pretty good and they rapidly raise your blood sugar. But we do have the typical gels, candies, all that stuff. Okay, so in here is the different gauzes. This is the more of that Hypafix. This is like a wound dressing. This is one long thing that you could actually shove into a bullet hole wound, but in Jesus' name, we're not gonna have any of that. So you can pour iodine on it, you can whatever, soak it in, whatever you want, I don't care. So over here we have gauze, and there is other gauze. Oh, separately divided up, I have the non-adherent pads. These are the ones that won't stick. So like they're shiny, they're plasticky, they won't absorb anything, but sometimes you want that. These are the regular gauze of all different sizes. Let's talk about, okay, so these ABD pads, if you have, we won't need those either, but just in case. Okay, let's talk about these petroleum gauzes. Okay, so these are what we would put over a burn, although if there honestly was a burn, I would use this dressing. It's a hydrogel dressing with tea tree oil, and I would probably use that. But this is like, God forbid we needed to make a chest seal. But you would put this with a non-stick ABD on something. You can kind of, I did put videos on the Medic YouTube that explains how to use these different things, but this is the petroleum dressing, then the ABD, then these are the zero form dressings. These are the ones that are like, that we probably will actually use quite a bit at, again, for the turf, because some of those turf wounds were nasty at summer camp. So we'll probably use those for that. It has like a little antibiotic. That's my antibiotic thing. And you would put these next to a non-ABD, like non-adherent dressing. These are Tegaderm transparent dressings of all different sizes. Okay, so then this is moleskin. I never really had much experience with moleskin before I started doing this, but this is moleskin that like you would put on to prevent blisters and things like that. You just stick it right to the skin, and then this creates like a barrier We use this a lot in theater. I also have some liquid bandage in here just in case, and some sterile Q-tips. So there's the liquid bandage. And then you guys, I have the Band-Aids all nice and labeled. This one's not labeled, but it will be. So regular and wide Band-Aids, regular. These are the pressure Band-Aids. These are the Steri-Strip butterflies. I am ordering a different type of Steri-Strip butterfly that looks to be super cool, and I can't, well, I don't want to have to try it, but it should be good. And then we do also have some of these, not very many, hydrogel Band-Aids. I wonder where all those went. Okay, so these extractors that we can put in the other things too, it's in the tools. This is where we'll have scissors. This is for like if you have a bee sting and the stinger's in, you put this on the skin and then you pull up, and it should help get the stinger out, as well as like the venom from a type of a bite. I mean, really, I guess it couldn't hurt to do it on a snake bite, but we're gonna do all the things that Karis's snake bite video says to do. If we had a snake bite, which we won't, in Jesus' name. Okay, so there's the KT tape. We have mostly manly colors in here. I do also have extra over there, but let's try to use the unwrapped stuff first. Let's not open, you know, all that. So, okay, these menthol hot patches have like 5 patches per bag. So that's why there's a couple that are open already. So please do not open a new one until, you know, all of them are gone. We're just really trying to steward the church's money, the tithers' money well, which is all of our money, you know, as well. So we do have some heating pads back here. We have some icy hot. Okay, so this magnesium spray, you guys know I love this stuff. If you have been with me before at all, stomach ache, you're getting magnesium. Dehydrated, you're getting magnesium spray. Anything, you're getting magnesium spray on your belly, preferably. You have muscle cramps, you're getting this sprayed on your muscle cramps if possible. So the arnica gel, super great. Yeah, that's arnica. Let's see, what else can I tell you guys? I know I have lights for us. You guys, there's so much stuff all over my house, but I'm trying to go kind of fast. So pain medicines, we have ibuprofen, Tylenol. These little aspirins are going to be in the little first aid kits with the masks for CPR, because this is in case somebody is having chest pain like a heart attack. You want to give them about 325 milligrams to chew. So if, you guys help me do math, what is 3 times 8 is 20, so then you do 5? I guess you'd do 4, 32. Yeah, look how smart I am. So you would chew 4 of these, or in the actual red bags, we'll also have the white pills that you can swallow. You can chew one of those, but those will say chew 1. Something that oh yeah, like this. I fill these bags up and I write chew 1, and I put like 10 in there. So the other thing that I want to talk to you about is these homeopathic pills. You'll have little bags like this in each of your bags that say like cold and allergy or pain. And in these bags, you'll have like, here's Benadryl. Here is Mucinex DM. That's, you know, for a cough or cold symptoms. These little things, for those of you who have not heard about my love of homeopathic stuff yet. These are, you take 2 of them and you put them under your tongue for like 30 seconds. You let them kind of dissolve there for 30 seconds. And then you start smashing them around against your mouth. And you're going to know because they all look exactly like this. They say Boiron, they say allergy relief, but you can kind of tell by the name of it, allergy calm, what it's going to do. Cycle ease, that's cramps. You're going to do 2 under the tongue. Yeah, so some of them look like this, and they have the actual instructions just so that you can see what they do. This betadine sore throat, you would use a cup from here. These cups, we're going to keep them. Oh, yeah, that's right, guys, because what we're going to do for medicine is we are going to have, so say somebody comes with a strained muscle or whatever, we're going to say, you know, if they ask for medicine or whatever, you can say, yeah, if it was me, I would take an Aleve, or I would take 2 Aleve. You're going to pour 2 Aleve into the lid, and you're going to set it down, and you're going to say, that's what I would take. If you want to take that, you're welcome to. We're not really going to be dispensing medicine, but we are, you know, providing over-the-counter medicines for them to take. So go in your comfort level, even though they have definitely like signed away all their rights on this thing, on this trip. Okay, so cold calm, obviously, for all the cold symptoms. Same type of thing because it says Boiron. But I also do have Benadryl in here. And even though I don't love it because it has Tylenol, and I just don't think these drugs really work, I have this cold and flu multi-symptom, so it's like Dayquil basically. This is great for sore throats. This is that Mucinex DM. Basically, this is for a cough, or sinus pressure. Both of these are my favorite, one of my favorite drugs in the world. These are just for a sore throat. These terrible ones that I did not buy are, you know, cough drops. There's Vapor Rub, and then there's Chloroseptic for like severe sore throats. Then over here is a mishmash of things that I need to go through. Maybe I'll just do a video going through our bags, but I'll show you 2 other things. So these charcoal pills, one year they had a ton of food poisoning. These are binder pills. So you would give them, like if people were feeling super sick or throwing up or whatever, you would give them 2 of these charcoal pills and it would just help to absorb everything that's going on. These Dramamine are for nausea, but I will say I love these. I feel like they work better. They're nausea calm. And again, they're homeopathic. You put them under your tongue. Diarrhea. I bet you can guess what that's for. Gas, any of that stuff. Although we do have Gas X, we have activated charcoal, we have ginger drops, we have peppermint, and we have Tums, and we have more magnesium. Magnesium is a person's best friend. Also, there's Pepto-Bismol if people want that. I think that is about it. At the camp already, we have just like ice packs. We were going to try to get an ice maker, but that did not work out. I also have extra gauze and gauze rolls packed up for us. I have a couple random things in case we do need to do irrigation. I have a couple snacks, like for us or people who have like super low blood sugar. These are canned air oxygen. These are the little things that will have our mouthpiece and aspirin in there. I think that's it for now, guys. I'm going to pack up all this stuff and then we'll kind of go through more stuff as it gets closer. Thank you.